Do you find yourself feeling down as the days get shorter and colder? Suddenly, you're not as upbeat as you were in the summertime. The winter blues start creeping in, but it's more than just that. You're tired, disinterested, and sometimes it even gets difficult to get out of bed. You're not alone. Millions of people experience these symptoms, often chalking it up to just another bad day or a typical winter slump. What if it's more than that? What if it's seasonal affective disorder, commonly known as seasonal depression? Well, the good news is there are effective treatments available to help you reclaim your life in the wintertime, even though they sound really stupid. Trust me, I laughed the first time too after I heard them. And who am I to guide you through this? My name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. So grab a cup of hot chocolate, throw on that favorite blanket, and get comfortable because we're about to beat down the winter woes. Imagine you're in a room filled with sunlight, lively conversations, and the aroma of fresh coffee. Everything's perfect, right? Now, imagine that slowly the light starts to fade, the room grows darker and colder, the conversations become distant whispers. This is what happens to millions of people affected by seasonal depression each year. But what's behind this dimming light? We'll get there in just a minute. According to the APA, or American Psychiatric Association, about 5% of adults in the US experience seasonal affective disorder. It's also more common in women than in men. And no, it's not a trivial matter. In severe cases, it can even lead to suicidal thoughts. So, what are the warning signs? They range from mild to severe and it can include fatigue, increased sleep, weight gain, irritability, and difficulty in focusing. It's like you're wrapped in a heavy blanket of despair that you can't shake off. Now, you may be wondering, isn't this just the winter blues? Not quite. The winter blues may last a few days and come and go, but think of seasonal depression as a long-term guest that overstays its welcome. Some people think it's just an excuse for being lazy or antisocial during winter, but the science begs to differ. So, back to that dimming light in the room, the culprit behind it isn't just the lack of sunlight, but a combination of factors that contribute to seasonal depression. Let's get into the science now. Have you ever found yourself going through old photos and wondering why you felt so happy during the summer vacation and not so much during winter? Is it just the lack of beach and cocktails, or is there something else at play? Well, a primary cause of seasonal depression is simply the lack of sunlight, which leads to a decrease in serotonin, the feel-good neurotransmitter. This might also explain why you feel down when the skies are gray. Melatonin, the hormone that helps us sleep, is also producing greater amounts by our bodies due to the lack of light, making you feel more sluggish. At the same time, serotonin takes a dip, and this physiological cocktail creates a recipe for seasonal depression. But it's not just environmental factors. Genetics play a role too. If your family has a history of depression or other mood disorders, you may be more susceptible. So, about those old photos and that nostalgic feeling of summer bliss, it's not just nostalgia, it's biology. The lack of sunlight and the hormonal imbalances are key players in why we feel so differently in various seasons. Picture this, you decide to repair a leaky faucet in your home. You've watched tutorials on YouTube, read the manual, and even bought the tools. But when you actually get down to it, you realize it's not as simple as tightening a screw or replacing a washer. This is the same thing with self-diagnosing mental health conditions, especially something as complex as seasonal depression. Before jumping to any conclusions or self-treating, it's essential to have a tailored treatment plan. Not every solution works for everyone. Like a suit that needs to be tailored to fit you perfectly, your treatment plan should be customized to suit your unique symptoms and life circumstances. So, just like that leaky faucet, you need someone who has dealt with countless faucets and knows exactly what to do. Similarly, a healthcare provider can offer a precise diagnosis and tailored treatment plan, which usually involves a comprehensive evaluation, often starting with a self-assessment questionnaire and followed by clinical interviews. You might also undergo laboratory tests to rule out other conditions that may have similar symptoms. With all of this, we can finally jump into treatment options. Imagine you're setting out on a road trip. You've identified your destination, but how do you get there? Do you opt for the scenic route, or is the expressway more your speed? Let's jump into the different routes that we can use to help with seasonal depression. The first one, and the one that sounds super stupid, is light therapy, which is the most commonly recommended treatment for seasonal depression. This involves sitting near a light box that mimics natural sunlight for about 20 to 30 minutes each day, ideally during your morning routine. I tell my patients to go on Amazon, type in light therapy lamp, and make sure they pick one that has the magic 10,000 lux, which is the strength of the light that's needed. Just like medication and doses, light comes in different wavelengths and intensity, and making sure to get the right one can make all the difference. It's simple, costs about $30 to $50, it's easy to integrate into your routine, and often shows results in a matter of days or weeks. Sometimes the light therapy box isn't quite enough, and the discussion shifts to medication. Antidepressants are often used to treat seasonal depression. In my practice, I like to use Wellbutrin XL or bupropion extended release for a few months in these cases, starting a few weeks before daylight savings time in the fall, and going until early spring. I like it because it can help with energy and giving a bit of get up and go kick, which is something often missing during the winter months. Always make sure to talk to your doctor about this option and make sure you go over the risks and benefits of treatment with any and all medications. If you're looking for less big pharma interventions, you can always support Big Supplement and look into some over-the-counter vitamin B and vitamin D supplementation. If taking a pill or two isn't your thing, cognitive behavioral therapy, CBT, can be particularly effective. It teaches you how to identify negative thought patterns and replace them with more constructive thoughts, allowing for flexibility and adaptability in your treatment. Aside from being useful in the winter months, understanding CBT concepts can be helpful in your average day-to-day life too. And lastly, if medication, supplementation, or therapy are too troublesome and you want something even more holistic, simple things like adjusting your sleep schedule a week or two before daylight savings time or using timed lights to mimic a natural day-night cycle can make a big difference as well. Also, make sure to establish boundaries between work and personal time, take breaks, and engage in activities that bring you joy. Whatever it is that you choose, preparation is key. Just as you prepare for that road trip we mentioned before, anticipating changes can help you stay ahead of seasonal depression symptoms. While seasonal depression can be a formidable obstacle, it doesn't have to define you. This condition is treatable, and with the right approach, you can find the balance you need to not only make it through the challenging seasons, but thrive all year round. Remember, the internet is a fantastic resource for gathering information, but it's not a substitute for professional medical advice. If you or someone you know is struggling with seasonal depression, I strongly urge you to consult a healthcare provider for an accurate diagnosis and tailored treatment plan. Wrapping up, I hope this video has equipped you with the knowledge and the tools you need to take action against seasonal depression. You're not alone and help is totally available. Make sure to drop a like, subscribe, all that good stuff. And until next time, take care of yourself. Remember, your mental health journey is a marathon, not a sprint. Be safe and be well.